I need somebody help, not just anybody help. You know I need someone help.
Today you have learned about the key concept of the proactive nature of hourly patient rounding, when and how to initiate a rapid response, code blue, and stroke alert, and the roles and responsibilities of the BLS responders in these types of situations. Now you will watch a video with a demonstration on the proper use of an automated external defibrillator in a code arrest situation. Remember, the role of the first responder in a code arrest situation is to first determine unresponsiveness of the patient. Second, activate the code arrest system by dialing 1-6666 on the telephone and giving the information to the operator. State code blue in your location. Initiate BLS. The role of the second responder in a code arrest situation is to bring the code card into the room. When the second responder has arrived, place the backboard under the patient's back and initiate two-person CPR. The second responder will apply the AED pads to the patient, turn the AED machine to on, and follow the prompts on the machine. The pads are placed on the right upper and left lower chest or anteriorly and posteriorly as shown on the pads. If you have a patient who is pregnant and is on a fetal heart monitor, be sure to turn the fetal heart monitor off before turning the AED on. If you have a patient who has an internal pacemaker on the right-hand side of their chest, make sure you do not apply the AED pads over that pacemaker. Connection between the pads and the cable on the AED goes green to green. Turn the knob on the AED to AED on and press the button under Analyze. The AED will analyze the patient's rhythm and instruct staff not to touch the patient.
Analyzing. Do not touch patient.
If a shock is necessary, the AED will give the instructions shock advised. The AED will charge to 150 joules and instruct staff to stand clear and to press the shock button. Once all staff is clear, press the shock button. Once the shock is delivered, the AED will give the notification shock delivered.
Shock advised. Stand clear. Press shock. Shock delivered.
As the code team arrives and takes over activities, all BLS responders except the patient's nurse must leave the room in order for the code team to function effectively. Let's review the application and use of the AED one more time. Apply the pads to the right upper and left lower chest or anteriorly and posteriorly as shown on the pads. Remember, do not place the pads over an internal pacemaker. Connection between the pads and the cable on the AED goes green to green. Turn the knob on the AED to AED on and press Analyze.
Analyzing. Do not touch patient. Shock advised. Stand clear. Press shock.
Again, once the shock is delivered, the AED will give the notification shock delivered. You should now be able to perform proper application and use of the AED and will be validated on your ability to correctly demonstrate these steps. Knowing how to apply and use the AED ensures the best patient outcome in a code arrest situation.
Won't you please help me, help me, help me.